Hi, welcome. Let's talk about the difference between transference and countertransference. If you like my videos, please support me through subscriptions and liking and sharing my videos. Thank you. Let's talk about transference. This is when a patient unknowingly redirects their feelings from a past relationship with someone they know onto the nurse. So the feelings are redirected from the patient's previous experience to the nurse. Countertransference. This is when the nurse redirects their own past feelings and experiences with someone else onto a patient. Or it could be the same person, but just a past experience. So, for countertransference, the emotions are redirected from the nurse's previous experience to the patient. I have examples and scenarios here. Let's start with the transference. Both transference and countertransference can appear in a positive or negative way. So let's look at the positive transference. A 20-year-old patient is assigned to a nurse who reminds her of her deeply supportive and kind grandma. Because of that, the patient views the nurse as trustworthy, compassionate, and is willing to open up and participate in care. On the negative side, if a patient who had an abusive parent is assigned to a nurse with a similar parental role or reminds them of their abusive parent, the patient is more likely to be hostile, resistant, argumentative, and possibly not as compliant to treatment as expected. Countertransference, the positive version. A nurse caring for an elderly patient who reminds them of their beloved grandparent. And because of that, the positive feelings could lead to over involvement, like becoming overly protective on this patient and maybe treating them like a family member rather than a professional client. On the negative side, a nurse caring for a patient who repeatedly refuses to follow treatment plans. So, this means the nurse has had previous experiences with this same patient not compliant and coming back for the same thing over and over again. So, the nurse will have a negative emotion towards the patient and they might have bias, they might stereotype them, and potentially they might not build a therapeutic relationship together. That's it, guys. Thank you for those who have subscribed. I see the growth. If you have not, kindly do so. Hit the subscription button, it's free. Look out for more and see you on the next one. Trust in the process, guys.